Now, the next common question that we get is, well, how safe is cataract surgery? So I want to talk to you a little bit about the risks of cataract surgery. Fortunately, in today's era, with the technology that we have, cataract surgery is very low risk indeed. We can usually use high technology, sometimes with lasers in our micro incisions, and we can really avoid a lot of the problems that come with eye surgery. The biggest risks with any surgery, of course, is the risk of infection. And that can be something that can be very severe. We try to have you wash your hands and stay as clean as possible and try to avoid any dirt or dust particles in the air. Try not to squeeze your eye after cataract surgery to put stress on the surgery itself. We want you to have a smooth recovery as much as you want to have a smooth recovery. But fortunately, the risk of infection is quite low. And that's a lot of it is really up to you. As long as you can take care of yourself and use your post-operative eye drops, we can usually avoid that risk of infection. The other risk that we're concerned about is usually retinal detachment. And fortunately, we can say that that's a pretty rare occurrence also. On average, it's about like a 1 in 1,000 chance-ish for having a retinal detachment. And of course, you have to believe me when I tell you this. I don't want you to have it as much as you don't want to have it. Unfortunately, that's just not up to us. And sometimes retinal detachments just happen with cataract surgery or any eye surgery. When we start to change the anatomy, things like that can happen. There is a small chance, even smaller than that, there is an even smaller chance of having permanent vision loss or damage to the vision permanently that we just can't recover. These are usually events that are just unpredictable and they happen completely out of the blue. For various reasons. Overall, all of these serious side effects are usually exceedingly rare. And again, we're on the same side as you, and we really don't want you to have these as much as you don't want to have these. Some of the other side effects are usually pretty minor. I would say the most common side effect is usually dry eyes. Dry eyes happens with any eye surgery, and it can be quite uncomfortable for a few weeks after surgery. I would say most people, it's really not too bad. There's an occasional person, however, who it takes several weeks, several months even to recover from the dry eyes. The eye can feel a little bit scratchy or like there's an eyelash in the eye. That usually heals over time with the use of artificial tears, lubricant eye drops, and sometimes working with your dry eyes eye doctor. Sometimes after cataract surgery, you'll notice that the eyelid can be a little bit droopier. That's usually largely in part due to age. As we get older, the muscles get a little bit weaker, and when we have to hold the eye open for about 15 minutes, sometimes you can stretch the ligaments and the eyelid can appear a little bit smaller, or the eyelid can be a little bit droopier after cataract surgery. Fortunately, most of the time, this tends to be a transient thing, and it's short-lived, and it does go away in time, but sometimes it can be a permanent thing. And it's pretty uncommon that it's so droopy that we have to actually have a second surgery to lift the eyelids in the following months. Overall, though, cataract surgery, we can do this in one surgery. It's on occasion, sometimes the cataracts are so dense and so difficult to take out that we require a lot of energy to remove them. And as such, when we're trying to take it out with a vibrating probe, sometimes pieces of or fragments of the cataract can bounce around and things become a little bit more bouncy and unstable. And unfortunately, that's not always within our control. If we have to take it out, and we don't often know the risks of the surgery until we're in the middle of surgery itself. Oftentimes, we can mitigate these risks. Your surgeon can change things at the time of surgery, but sometimes they're just unavoidable. And sometimes fragments or pieces of cataract get left behind. Sometimes that does mean a second surgery, or rarely a third surgery, to take out all the remaining fragments of the cataract. And sometimes it does mean we have to a third surgery, or at a later date, we actually have to implant a lens implant so you can restore your vision again. I would say that all of these, all in all, any sort of side effects that happen from cataract surgery are pretty rare. They really don't happen all that often. But it's important that you understand that there are certain risks inherent to any surgery. But fortunately, with cataract surgery, these are very small and infrequent.